Alright, so we're going to start with the latissimus dorsi, the broad muscle that extends from the middle of the back to the humerus. You can find it starting down the side of the back to the lumbodorsal fascia, and its job is to pull the kitty's forelimb dorsally and posteriorly. Human, right there. Trapezius. It's been cut because we got to see all the muscles underneath. This guy is going from the back of the neck to the clavicle. The origins are listed as the occipital bone and the vertebrae, with the insertions being the scapula and the clavicle. It extends the neck and raises and lowers the shoulder, so it makes you shrug. So in this man, it's going to be this guy right here. Rhomboideus. To see that muscle, it helps to pull those four limbs anteriorly. The origin is the vertebrae.
Beneath the trapezius.
Yes, cut the trapezius out of the way. There we go. And its action is to adduct and move the scapula dorsally. Origin is vertebrae, insertion is the scapula. Splenius.
Wait a minute. What's the muscle you just...
Rhomboideus.
Okay.
The splenius is, where am I on this page? The broad muscle covering the back of the neck. Broad muscle covering the back of the neck.
The wrestler's muscle.
Wrestler's muscle. Did not know that.
The no-neck guys.
Oh. The origin is several vertebrae and inserts on the temporal bones. The action is to rotate the head and to extend the neck. Supraspinatus. So for this one, I recommend finding that shoulder blade, which you already know. Find the spine of the scapula. So if it's the supraspinatus, it's superior to the spine of the scapula. That guy is originating on the scapula, inserting on the humerus. Its action is to abduct or extend the humerus. And then the infraspinatus would be inferior to the spine. How easy is that? Yay! Origin of the scapula also inserts on the humerus. Its action is to laterally rotate the humerus. If you look at the lab PowerPoints that I made, you can actually see all the muscles are taken away except for the one that I'm talking about, and you can see where the infraspinatus is attaching to the humerus, so it makes sense that it laterally rotates. Teres major. Kind of have to, there we go. It's that long skinny muscle underneath, just inferior to the infraspinatus. So it's just got her finger on it, right there. Right, there. And it's going to the medial side of humerus. So originating yes ma'am, originating on the scapula, and it is going towards the medial side of the humerus, so it allows medial rotation of the humerus, and it also adducts the arm. Okay. Deltoid, can't find that guy on the kitty. Kitties don't raise their arm that way very often except to groom. So here it is on Mr. Man right here. That's the muscle that you get your vaccinations in usually.
It's a group of muscles, actually. It's a group, but they only
It's a group, okay. Be sure to identify in the man. Originates on the scapula and clavicle and inserts on the humerus. Primary action is to abduct the arm. Okay, masseter. This is a thick muscle of the jaw inferior to the ear. It originates on the zygomatic arch. Originating on the zygomatic arch and inserting on the mandible. Its purpose is to raise the jaw. On the kitty.
Usually it's not deceptive. Out here, this is the big fat cheek. The cheek.
There you go. Cheek. Okay. Temporalis is a synergist to the masseter.
it's above.
I think it's dissected on this. Yeah,
Here it is.
right there. So it is originating, luckily, on the temporal bone, so that makes it easier. It's also inserting on the mandible. It's inserting at the coronoid process instead of the ramus of the mandible, and that also raises the jaw. Pectoralis group. Yep. Can you point it again? Okay. Pectoralis group, that's originating at the sternum. We just do the whole group, no major, minor, anything like that. Inserts on the humerus. Its action is to adduct the forelimb anteriorly. Okay. Sternocleidomastoid starts at the sternum and the clavicle, sternocleidoid, and it inserts on the mastoid process of the temporal bone. On the kitty, it kind of looks like a V. This one, it's decently dissected out.
Yeah, usually you can't find it because that's where they do the injections.
Yeah, it does get messed up on the injections, but
they have two, remember?
yeah, one on each side. So if it contracts, if both of them contract, then the neck is flexed. But if one of them contracts, then it kind of cocks the neck down to the
They
side.
actually have two separate ones.
Yes, but on
So they move their heads a lot further than we do.
yes, so it's this
No.
V-shaped muscles
Right.
coming down
here.
like that. Okay. Digastric. It actually has multiple parts, but the one that would show up on the kitty that we would put, because part of it is tucked inside the skull, is this little V-shaped muscle underneath the chin, right there. Okay. This guy lowers the jaw. It's a smaller muscle because gravity helps us lower our jaw, so we don't need quite as much work for that. So it's the antagonist to the masseter and the temporalis muscle, and it originates on the mastoid process and inserts on the mandible. Triceps. Triceps, because it's got three parts. It is originating on the scapula and the humerus, inserting on the olecranon process to extend the elbow. And on the human, it's on the underneath side right there, going to the olecranon process.
Yeah. Tri-head, three heads.
Biceps is flexing the elbow, originates on the scapula, inserts on the radius. That's the Popeye muscle. Oh, Mr. Man's caught. There we go. So there's the biceps. It's two-headed. Triceps 3, biceps 2. Okay, serratus ventralis. This is the fan-shaped muscle. You have to cut the pectoralis out of the way. It originates on the ribs, inserts on the scapula ventrally, and it pulls that scapula ventrally. Intercostals. Short little muscles between the ribs. There's actually external and internal. They help you breathe, originating and inserting on the ribs. Okay, the obliques. Starting with the external oblique, it originates on the ribs and the lumbodorsal fascia.
Fibers go down.
Fibers go down. Unzoom that a little bit. And action is to constrict the muscle. Okay. Let's see, I said the origin. I didn't say the inserts on the linea alba in the middle. So the white line right smack down on the middle on the kidney. Okay. Internal oblique. This one is just barely kind of tucked up underneath you. You have to dissect it out thinly away from the external oblique, and honestly, a lot of times it gets pretty shredded on the kitty.
Just know where it is and what direction the fibers go.
Just know where it is and the
The
direction
four
of the
muscles and the fibers head in different directions. That's why you have all those ab exercises.
all those ab exercises. You do those ab exercises, Miss D'Angelis?
I
don't do
try.
those. Maybe that's why you're tiny. I'm not. All right. So it originates on the pelvic girdle and the lumbodorsal fascia. It inserts also at the linea alba, also constricts the abdomen. Transversus abdominis, we have new fiber direction. They run kind of downward and slightly backwards. Origin, insertion, action, all the same as internal oblique. Rectus abdominis, rectus means straight, going down the middle. If he pointed it out, he probably pointed it out on the human. There we go. So the
Six-pack muscle.
six-pack muscle. I see 8 on Mr.
This
Man.
external oblique right there. Linea alba.
Originates on the pubis, inserts on the sternum and costal cartilages. It flexes the body. Gluteus maximus is not maximus on the kitty. It's much smaller. Of course, in the human, it is larger.
Nice.
Yes, very nice. It originates on the pelvic girdle. It is going down, inserting on the femur to abduct the thigh, extend the hip. The gluteus medius is originating on the ilium. It's much bigger on the kitty. It's kind of tucked
show
away.
very well on the
Yeah,
model.
its fibers go straight down from the ilium underneath the gluteus maximus. And it's going to go and insert on the greater trochanter. So that's why you have to know where the greater trochanter is. It medially rotates the thigh. Sartorius. Sartorius originates on the iliac crest, inserts on the tibia and patella. It adducts and rotates the leg. So it's starting way down there at the iliac crest, coming over the leg a little bit. It's skinnier on a human. That's what lets you cross your legs. So if that muscle contracts, gets shorter, it helps you.
Anytime you look at a photograph or a video of men running, this muscle is very obvious. It's so pretty.
It's so pretty. Gracilis.
Now,
Oh, what?
remember, in the cat, it's just a sheet of muscle.
And the cat, and the cat is very much more flat. Okay, gracilis. The gracilis is on the dorsomedial surface of the thigh. It originates at the pubic symphysis, inserts on the tibia, and it adducts.
Let's see here. Here we go.
Adducts the thigh. So, quadriceps group. It's quadriceps because it's got 4 parts. The 4th one is pretty hidden. So it is originating on the ilium and on the femur. It's inserting on the tibial tuberosity right there. So starting with the vastus lateralis, it's the largest one outside of the hot dog.
We're get shots.
Yeah, you do get shots.
Babies especially.
Rectus femoris, remember rectus means straight, so that is the hot dog in the
right
middle
there.
of the
Okay,
bun.
right there.
And the vastus medialis is the muscle immediately medial to the rectus femoris. So it looks like a hot dog. The vastus intermedius is underneath the rectus femoris, so you'd have to kind of pull that out of the way, and it's up against the femur there. But usually it looks like just a little hot dog. Okay. All right, adductor group, we just do the whole group. And so just like the name says, it adducts the thigh there. Gracilis is kind of in the way, but you can see underneath it. It originates on the pubis, inserts on the femur. Hamstring group. Hamstring is the antagonist to the quadriceps. It's got 3 parts. On the kitty, here we go. On the kitty, the biceps femoris is very big. So it's that thick lateral thigh right there, thigh muscle right there. On the human, it is still lateral, but it looks almost the same size as the semitendinosus. Okay, semitendinosus on the kitty is skinny, and it's going down towards the tibia. It usually gets cut, so she's got it in her hand right there, and it usually ends up getting ripped at the tendon, but it's the going down towards the tibia. The semimembranosus is more medial and fat. Yeah, there you go. And on the human, the semimembranosus is actually kind of tucked, so you can see part of it sticking out from right there, and then part of it sticking out from right there underneath the semitendinosus. All right, gastrocnemius. This is the large calf muscle. It's got two parts also. So it's originating on the femur, inserting on the calcaneus.
Achilles tendon.
Yep, it's called the Achilles tendon right there. You can see tucked right up underneath that tendon is another muscle. That's going to be the next one that we're going to talk about is the soleus.
Sorry, the nerve got in the way.
It's okay.
Soleus.
So, soleus, and right here on this man right there. So there's the the gastrocnemius tendon right there, and there's this flat muscle right there. If anybody knows what a solefish is, you know it's a very flat fish, and it's joining the.
Look at that nerve.
That's a beautiful nerve. Mm-hmm. It's joining the calcaneus also. Mm-hmm. The whole thing with the soleus and the gastrocnemius, they work to do plantar flexion, so tiptoe.
The ballerina.
Yes.
And the reason for high heels.
Ugh, pain. Okay, anterior tibialis muscle is on the anterior surface of the tibia. Antagonist to the gastroc. It causes dorsoflexion of the ankle. It's going to originate on the tibia, and it's going to go down and insert on the first metatarsal bone down there. All right. Is that it, Mr. Angelos? I think that's it. Mm-hmm. All right. Thank you, ma'am, for helping our students. Smile.
You're more than welcome.
See you later.
Fun learning these. While we're here.
Turn it off? Or
No.
No, keep going.
The sciatic nerve, okay? They forget that. Remember the sciatic nerve?
Yeah.
Okay, so that's it. Remember, that's strong enough to hold the whole kitty up.
Strong enough to hold the whole kitty up. Mm-hmm. Okay.
Good luck.
Thank you.
You're welcome.